Well, good afternoon, and thank you for joining us for this month's virtual town hall. Now, we're really looking forward to sharing the updates on our COVID-19 vaccine program and other BAMC news. So to start, I'd like to welcome our distinguished panel of experts. To my left, our battle buddy, Command Sergeant Major Thurman Reynolds, Lieutenant Colonel Elizabeth Markells, infectious disease physician here at BAMC, and Major Jared Brynildson, officer in charge of the COVID-19 vaccination program here at BAMC. Over the next hour or so, we will do our best to address as many of your questions as possible. And we invite you to continue to submit questions during the town hall by posting them in the comments section on Facebook. Command Sergeant Major, over to you.
Hey, thank you, sir. First and foremost, I'd like to thank the entire team for their incredible efforts. We have overcome many challenges over the past year, most recently with the snowpocalypse. As always, the CG and I are very impressed with your dedication and commitment to the mission. Even as we dealt with the winter storms, we appreciate everyone who pitched in during that time, whether you contributed here in the hospital or from home while struggling with power, water, and internet outages.
Yeah, Command Sergeant Major, I absolutely agree. We heard countless examples of selfless service and sacrifice across the formation. Many of the inpatient staff stayed long after their shifts to assist their colleagues and to fill in for folks who couldn't make it. The Department of Nutritional Medicine worked tirelessly to ensure our staff and patients had hot meals. And in an effort to aid our community's power conservation efforts, our facilities management team ensured a seamless transition to generator power for nearly 48 hours. This proactive measure not only helped conserve power within the city of San Antonio, but also ensured that our healthcare mission was not impacted. I can't even begin to tell you how amazing your efforts were, so thank you.
Sir, I would like to add a shout out to our pharmacy staff. They've been doing a great job making sure our beneficiaries get the medications they need throughout this pandemic. Last week, they completed the move of the Fort Sam Houston Community Pharmacy to the new Exchange building. As a reminder, until the new Exchange opens for business, pharmacy customers will need to enter through the side entrance of the building. We look forward to offering our patients one-stop shopping and convenient parking.
Yeah, we're extremely proud of the pharmacy team. Now, in other news, Texas Governor Greg Abbott is lifting the state's mask mandate and allowing businesses to open at full capacity beginning tomorrow. Now, please keep in mind that as a federal installation, Joint Base San Antonio is required to adhere to Department of Defense guidelines and policies in line with Joint Base San Antonio. All individuals are required to wear a face covering and maintain physical distancing while on post. This includes not just BAMC, but all the outlying clinics and the patient-centered medical homes around the city.
We highly encourage everyone to remain vigilant, both on and off duty, and to maintain safety precautions at all times to protect yourself and those around you. Continue to follow the 3 W's. Wear a mask, wash your hands or hand sanitize regularly, and watch your physical distance. If you feel sick, call before coming in.
Yeah, and along with face coverings, another important way to prevent COVID-19 is by getting the vaccine. Now, last week, we expanded the COVID vaccine program to TRICARE beneficiaries, whether enrolled or not, ages 65 and older. And we've recently opened additional appointments for this population. If you were unable to book an appointment yesterday, please visit TRICARE online to book your appointment today. You can also call our appointment line at 210-916-9900, option 8. We're also excited to announce that later this week, we'll begin contacting high-risk patients ages 16 to 64 directly to book their first vaccination. Now, we'll post updates on all of our sites as we move forward to ensure everyone is tracking this process. We also continue to offer the vaccine to our DoD Tier 1 Alpha and 1 Bravo military and civilian personnel. This expansion is a testament to the hard work taking place behind the scenes. Since relocating to the new vaccine site on Fort Sam proper, our team has done a phenomenal job getting people through safely and efficiently. A big shout out to all who are involved with the vaccine program for your hard work and devotion to this vital mission.
In other vaccine news, the Department of Defense is preparing to roll out Johnson & Johnson's COVID-19 vaccine. which received emergency use authorization on 27 February for individuals ages 18 and older. This vaccine is highly effective and safe, with studies showing no hospitalizations or deaths in people receiving the vaccine. Because this one-dose vaccine can be stored without special freezers, the Department of Defense will initially designate it for forces deployed to austere locations. BAMC will continue to use the Pfizer vaccine at this time.
Yeah, so the newly approved vaccine on the EUA, along with the Pfizer and Moderna vaccines, will help to increase the overall supply and distribution rate across the nation. In a tremendous milestone, the DoD now has administered more than 1 million COVID-19 vaccinations. Every dose administered helps protect our loved ones, our colleagues, and our community against the virus and brings us one step closer to ending this pandemic.
Before we move on to the questions, we wanted to provide an update on concerns raised during recent town halls. Several people asked about the stop signs in the parking garage, and the good news is they have been reinstalled. Please keep an eye out to ensure you don't run a stop sign. Additionally, the digital signs that display the number of available spaces on each floor of the parking garage have been fixed. We also heard from several people that the barriers at the front gate are too high. The middle exit barrier is now locked, so if you have a vehicle that's low to the ground, please use the center lane.
That's really great news, and it shows that, we take this seriously and we listen and we try to get results for you. As a final update, we also received several questions regarding routine dental care, and I'm happy to announce that dental clinics on Fort Sam Houston resumed routine dental care on 1 March. So please call your assigned clinic for an appointment. And we greatly appreciate everyone raising these issues and giving us the opportunity to make improvements. As a reminder to our team, please don't hesitate to raise questions or concerns using your chain of command. If you need additional assistance, please remember the Command Sergeant Major and I have an open door policy. And the staff can also use the Ask the CG Command Sergeant Major program by clicking the icon on the front page of the BAMC SharePoint. Your voice matters, and by raising these concerns, you are truly making a difference.
One concern that we hear about often is speeding on the BAMC campus. Please make sure you are driving slowly and cautiously at all times, and help put our patients first by using the parking garage. Finally, please police your areas so we are all doing our part to keep the grounds clean. Our patients and visitors' first impression of our hospital starts at the gate, and the parking areas are an extension of our facility. We want everyone to feel confident that our high standards and attention to detail are not just evident inside our hospital, but in our surroundings as well. Remember our value of dignity and respect.
Yeah, and speaking of safety, many of you have kids on spring break this week. We highly encourage you to take some time off if you're able. We can't stress this enough. We are in a marathon, not a sprint. We've said this before. We've been going at full speed as a team for over a year, and we all need time to rest and recharge. So please continue to take care of yourselves and each other, stay vigilant, and please stay safe. Finally, please keep our deployed service members and their families in mind. We have many soldiers and airmen deployed around the country and really around the world in support of COVID-19 efforts and other DoD missions. So please keep them in your thoughts and prayers. So now let's move on to some questions, Elaine.
Thank you, sir, Command Sergeant Major. I'm Elaine Sanchez, BAMC's Public Affairs Officer. Welcome to this month's Facebook Live Town Hall. Thank you to everyone who submitted questions in advance. We do our best to answer all questions during the Town Hall, but do reserve a few for the Commander's message, the BAMC 6 sends. So please keep an eye out for that weekly email. If you're watching on Facebook, we welcome you to post your questions regarding COVID or any topic during the Town Hall in the comments section, and we will do our best to answer them over the next hour or so. We've received a variety of pre-submitted questions this month. The first few are focused on COVID-19. To start, Texas is lifting the requirement for face coverings and allowing businesses to open with 100% capacity. In light of this news, can we proactively plan now in case of a COVID surge?
Sir, I'll take this question. So please be assured that our hospital system remains vigilant. We monitor positivity rates across the region and hospitalization rates daily, sometimes hourly, to ensure we can carry out our healthcare and trauma missions. We closely monitor conditions within the community to see if we need to adjust services in any way. As a result, over the past year, we've been able to quickly scale back or increase services based on the current situation. We will continue to stay vigilant to ensure the safety of our patients, staff, and families. While face coverings will no longer be required within our community, they are still required on a military installation, which includes our hospital and outlying clinic. We also encourage everyone to continue to practice the same safety precautions, whether on or off post. Please wear a mask, wash your hands thoroughly, and watch your physical distance. When available to you, we really encourage you to get the COVID vaccine. Until we achieve public immunity, these safety precautions are the best way to protect ourselves and those around us.
Next question. Why do we have to wear a mask when coming through the gate when we are at Health Protection Condition Bravo Plus?
So, sorry, I'll take this one. Drivers coming into the installation do not need to wear a mask if they are in a car by themselves or with family members. However, as with all military installations, Joint Base San Antonio has been directed by the Department of Defense to require face coverings on all shared spaces on post other than someone's home, regardless of health protection condition. COVID-19 is one of the deadliest threats our nation has ever faced. It is imperative that we do all we can to ensure the health and safety of our force, our families, and our communities so we can prevail in this fight.
Thank you. We are receiving some Facebook questions, but we'll ask one more pre-submitted and then we'll switch over. Since the Texas governor is allowing all businesses to open at 100% capacity beginning 10 March, will BAMC end teleworking due to COVID-19?
I'll take that. So first off, we're incredibly proud of how our leaders have leveraged telework to help decrease the spread of COVID-19 throughout BAMC and to accommodate staff with health or family concerns. Now, our ability to sustain the mission during the recent winter storms was partly due to our experience from, quite frankly, working from home. The pandemic has certainly accelerated the remote work trend within our nation. So taking lessons learned, we'll continue to look for ways to leverage telework to increase efficiencies and aid in space constraints across the organization. Now, keeping in mind that some jobs really do require a physical presence. In other words, we don't anticipate ending telework across the board, and we encourage everyone to discuss individual questions and concerns with their supervisors.
Okay, moving to Facebook. Thank you for submitting your questions. The first one is, what is BAMC and Joint Base San Antonio and DoD as a whole, which is pretty broad, doing to accelerate the vaccination process to assure the safety of beneficiaries?
Sure, I can take this one. So the question is, what are we doing to accelerate the vaccinations of the beneficiary population? Well, we are aggressively as we can pursuing more vaccinations, more vaccines to be able to vaccinate the population. We are taking a holistic approach, working across the marketplace with Wilford Hall and Randolph, and trying to determine what those most risk populations are and vaccinating as quickly as possible, and amending the demand signal for more vaccines across the marketplace to try and continue to vaccinate as best as we can.
Yeah, I'll add on to that. So I think what people need to understand is that BAMC, like all facilities, are vaccine receivers, not vaccine orderers. So the way this works is, and I think we may have explained this before, you can correct me if I'm wrong, but the National COVID Vaccine Response through the White House basically determines what allocation to give jurisdictions each week. The DoD is one jurisdiction of many, just like states and FEMA and other federal entities are. The DoD gets a certain allocation that goes to the joint staff. The DoD joint staff then distributes to the services. The Army, Navy, and Air Force each get a portion. We, as an Army, as BAMC being an Army unit, we get a portion of the Army allocation each week. Part of the calculus that goes into that is our supported population, but also how many shots a day that we can give, and what is the demand. So it's multifactorial, but the way that we are trying to accelerate that is by opening up the shot site on Fort Sam so that we can increase the number of vaccinations that we can provide per day, giving a demand signal up through the services to the Department of Defense. That's kind of that's our strategy. Can I add to that?
No, sir, I don't think there's really much to add, but the biggest key to what you mentioned there, sir, was that additional facility on Fort Sam Houston. The ability to vaccinate more now increases that demand to give us more to be able to get after the larger beneficiary population that we have here in San Antonio. So that was key to what we're doing. That's still a relatively new site and facility, so we are now seeing some of the fruits of those labors with increased vaccine on the projection forecast.
And the other thing that we've undertaken is marketing campaign, allowing and letting folks know when it's available to them. So, for example, once we got through our tier 1 military and we were able to move on to the civilians, and now we're moving down the age group and risk category. And as we get more supply and we're able to meet the demand, we'll start advertising who is up next and who's eligible so that people can call in for an appointment. So thank you. Appreciate the question.
Thank you very much. And we do encourage everybody to keep an eye on our social media site because we post the most current information there. The next question from Facebook: how does an elderly veteran who doesn't have TRICARE and has never been to the VA obtain a COVID vaccine?
So that's a great question. So if you are a veteran, you can enroll with VA services, and I recommend that you do that in order to be able to get the vaccine. So they're being very proactive and vaccinated anyone who's enrolled. So if you have prior military services, you can go through the enrollment process and get the vaccine through the VA.
Yeah, likewise, there are going to be community sources such as the site at the Alamo Dome where they're providing them for all citizens. Having said that, I think that the Johnson & Johnson vaccine release will probably be a game changer in the sense that it'll be more available in the community. The ability to bring in a single dose vaccine without a freezer requirement is going to really hopefully open up the ability to give shots to more people in the population. And so, it won't be a matter of veteran status. If it's just available in the community, it'll be available to, at drugstores, hopefully, in the very near future. I think that's the direction we're headed in.
No, nothing significant to add, just the community resources such as WellMed, in addition to Alamo Dome, has been a huge resource for personnel that are non-beneficiaries to receive their vaccinations.
We'll go ahead and post a link to the city site, COVID site. I did sign up for a service where they send you texts when COVID vaccines are available in the community, so that might be helpful to the person who sent in the Facebook question. We're going to go back to the pre-submitted questions. Can we improve the COVID vaccine scheduling process for staff? Is there a way we can just call an appointment line?
Sure, I'll take this. So, yes, there is, and we are working this currently. What we don't want to do as we move forward through the priority tiers is leave the remainder of the BAMC staff behind. So we are working on a process that will allow the individual BAMC staff members as well as other outlying clinics to request individual appointments through that process, and ensure that we get rid of the older process, which was required at the time, but to allow the individuals to book it individually.
Thank you. I have received my first dose of Pfizer, but I'm moving overseas and they only have Moderna. Can I get Moderna as my second dose?
So I will take this question. So the messenger RNA COVID-19 vaccines are not interchangeable with each other. Therefore, you should take all necessary planning steps to ensure you are at a location that has the same vaccine product as your first dose. However, the Centers for Disease Control and Prevention has stated that in truly exceptional circumstances in which the first dose vaccine product cannot be determined or is no longer available, any available messenger RNA COVID-19 vaccine may be administered at a minimal interval of 28 days. So that's because that's the longest duration for the Moderna vaccine. So you can do it in extenuating circumstances.
Thank you very much. Next question, how can I sign up to get the vaccine?
Sure, I'll take this one. We are currently administering the vaccine to beneficiaries 65 and older. The quickest way to make an appointment is through the TRICARE Online patient portal. To access the portal, you will first need to register for an account. This site does offer beneficiaries 24/7 access to make appointments quickly and conveniently. You can also book an appointment by calling the Console Appointment Management Office, otherwise known as CAMO, at 210-916-9900, option 8. And that's from 0630 to 4:30 p.m. Please keep in mind that hold times may be longer than usual. Additionally, if you are a GS employee or a contractor not otherwise considered TRICARE eligible, then you will need to work with your organizational leadership to book a vaccine appointment. And like the CG stated earlier, we will begin contacting high-risk patients ages 16 to 64 directly to book their first vaccination. We will post announcements on social media and our website once we open appointments for this population. Thanks.
Now, just to clarify, the 16 to 64 high risk, the ones that we contact are going to be the ones that are enrolled to BAMC, right? Because those are the ones that we know what their conditions are. With that said, vaccinations are open not just to enrolled beneficiaries, but all beneficiaries that meet the criteria. Did I say anything
Yes,
out
sir.
of turn?
Right, spot on.
Thanks.
Thank you. There's a follow-on question, ma'am, to the question that was asked earlier about the Pfizer to Moderna.
Yeah.
So someone asked if we were stationed at a different duty station that offered the Moderna vaccine, what do we do if we PCS here and the Pfizer's offered here?
Correct. So again, I mean, ideally, you would try to complete the series prior to PCSing or moving. But again, in the situation of extenuating circumstances, we will complete your vaccine series, and we would not give it any earlier than 28 days.
Thank you. The next question, I received the Pfizer vaccine here at BAMC. How long is this vaccine good for?
Oh, that's a great question. And as of now, we really don't know because the vaccine and the viruses are quite new. They've only been around for about a year. So we have some data showing immunity for about 4 months after vaccination with a messenger RNA, and then some data for about 8 months after natural infection, but sometimes it's been as little as 3 months, 90 days. It is possible vaccines against COVID-19 will be offered annually like the influenza vaccine, but it's really too early to tell. Reassuringly, there are many efforts underway to address these questions, and I'm certain we will continue to have more updates as we track responses among the millions of people vaccinated. I think that's the really important thing to highlight, that is that we are looking at this response daily, and we will continue to have updates regarding long-term immunity.
Our inpatient nurses are being tasked to assist COVID efforts across the nation. But what about here at BAMC? Can we request more nursing support?
Yeah, so I'll take that. That's a great question, and I appreciate the question. Understand that we are a military hospital. Wilford Hall is a military hospital. Therefore, our primary mission is twofold. It's to provide medically ready forces to deploy and ready medical forces to deploy. So there's no scenario in which there's a national mission where we simply don't play. With that said, we understand that we're honored to serve our nation both stateside and overseas. And so doing that mission is going to cause stress. And there's no denying that this past year has been extremely challenging for everyone. The inpatient nursing team has been working at a high up tempo for many months. And for that reason, the leadership team has been messaging the need to identify which services and which tasks can be curtailed for a certain time to ensure that we can sustain our primary healthcare mission and support DoD operations simultaneously. Okay, I understand it's a zero-sum game, but at bottom, we will deploy. The demand is not just here at BAMC, it's across the DoD, and the just plain truth is, as a large platform, we have the most ready medics to send. And there are other MTFs where they have fewer medics and no network. We have a network, so we have to balance it. We ask that you elevate your suggestions and concerns up to the chain of command so that we can continue to improve and adjust what we do and when we do it. In the meantime, please know that Command Sergeant Major Reynolds and I are in awe of the nursing team's dedication and professionalism. And we watch this on a daily basis. What is our bed census? What is our available staffing? and we adjust accordingly. So it is something that we track very closely. Thank you.
According to some news sources, both Pfizer and Moderna are either studying or testing a third booster dose to counteract against emerging and future variants of COVID, such as the South African variant. Once FDA approval is granted, what is BAMC's plan to ensure that a booster dose is administered to staff as quickly as possible?
Sure, we'll take this. First, I'm going to address the ongoing research regarding the third booster. So I remain very impressed by the scientific community and their rapid response to this pandemic and variant. Pfizer recently announced their plan for a research study to evaluate the safety and efficacy of a third dose of the Pfizer-BioNTech COVID-19 vaccine. This will help them better understand the effect of a booster on immunity against COVID-19 caused by the circulating and as well as the emerging SARS-CoV-2 strain. The study participants will be offered the opportunity to receive a booster of the current vaccine either 6 to 12 months after receiving their initial 2-dose regimen. Additionally, in response to strain changes, Pfizer and BioNTech are developing a variant-specific vaccine with a modified messenger RNA sequence based on the most atypical strain, which is the South African strain B1351. So this would provide a quicker turnaround time for a new vaccine if the need arises. However, the good news is current evidence shows that Pfizer vaccine has efficacy against the current circulating variant. So in the event the third dose receives emergency use authorization, I'm certain BAMC will follow DoD and Defense Health Agency guidance for distribution and administration of the booster. Unfortunately, we already have experience with messenger RNAs and will be able to implement an effective vaccination plan based on available supply.
Thank you. Earlier, we were talking about how we're going to be offering appointments to high-risk beneficiaries ages 16 to 64 by contacting them directly. What is considered a high-risk condition for vaccine purposes? Will I need to show proof of my condition to make an appointment?
Yeah, sure, take this. Yeah, when we open appointments for our high-risk beneficiaries, which are ages 16 to 64, they will be asked to identify their medical condition for documentation purposes only. They will not need to bring their documentation to the actual appointment. The DoD uses CDC guidance to determine which conditions place people at the increased risk for severe illness. But please keep in mind that the list of medical conditions that put people at increased risk for severe COVID-19 associated illness is updated routinely as new data becomes available. These conditions include, but are certainly not limited to, cancer, chronic kidney disease, chronic obstructive pulmonary disease, heart conditions, type 2 diabetes, sickle cell disease, severe obesity, including and meaning a BMI greater than 40, pregnancy, and smoking. You can find a full list on the CDC website. We will include a link in the comment section as well. Individuals with underlying medical conditions, including those conditions that previously mentioned, should consult with their healthcare providers about personal risk factors and circumstances to determine whether extra precautions are warranted.
I think we got another COVID-related Facebook question. So before we move on to another topic, has the COVID vaccine been approved for pregnant soldiers and civilians? If so, which one and which trimester is it best to get it?
Sure, I'll take this question. So yes, ACOG has encouraged all pregnant individuals, pregnant women, to get the vaccine, and this would be any of the vaccines that have emergency use authorization. So that would be the Pfizer, the Moderna, as well as the Johnson & Johnson. And with as far as vaccination, it's recommended to get it as soon as possible.
Thank you. Many of us are stressed, meaning the staff and people in a general, but are not sure of the best way to reach behavioral health for assistance. Can you streamline this process so people can get the help they need quickly and efficiently?
I'll take this. So first off, I really appreciate people asking that. I want to commend the person who sent that in for your courage and strength in seeking the help you need and looking out for your battle buddies. As leaders, we need to ensure the process for seeking help does not add further stress. The good news is the Department of Behavioral Health is implementing a single number to access all services. And this will simplify the way that individuals can seek help and put them directly in touch with the behavioral health staff. In the meantime, the behavioral health support line, 539-9567 is available for weekdays 7:30 to 15:30, 3:30 p.m. Provide additional support in managing stress and anxiety. When we get the new single number, we'll put that out. But please don't hesitate to call. Behavioral health is also streamlining its consult review process to get people the earliest appointment possible. As a reminder, you can also reach out to a chaplain or any member of your chain of command for support. If the situation is urgent, please call 911. Don't handle it by yourself. We all struggle at times, and it really takes courage to seek help. To use a gym reference, just because you can carry the weight doesn't mean that it isn't heavy and you shouldn't carry it alone. Remember to check in with your colleagues and friends to see if you can help lighten their load.
The Army has a new initiative called This Is My Squad that emphasizes the importance of looking out for each other. This Is My Squad encourages soldiers, and the term soldiers can refer to everyone on our team, to talk to one another. It's about having those important and occasionally difficult conversations about what's going on in their lives, their background, and the challenges they face. This program extends to every member of the BAMC family. We need to take care of each other, whether on or off duty. Team BAMC is our squad, and we have your back. And I encourage leaders at all echelons to make sure you get to know your team members and conversate with them daily.
Thank you. And we just posted some more information about This Is My Squad in the comments section on Facebook. A staff member asked if we can increase the number of climate surveys to ensure leaders are tracking morale issues.
I'll take this. I'm surprised to get that question because command climate survey, I think people are surveyed out. However, having said that, climate surveys are a valuable tool. They detect trends and issues across the organization and help us better communicate and support the team. Now, if issues are isolated to a specific department or clinic or unit, a localized climate survey may be a useful leadership tool. But unfortunately, the survey participation rates that as I've experienced, has been pretty low. I think that when we did our last command climate survey, there was a 17% response rate. So, that's why it's vital for us to have other avenues for communication, such as Facebook Live, such as the Ask the CG Command Sergeant Major. And we encourage everyone to use their chain of command first, while keeping in mind that your senior leaders do have an open door policy. And as I said, staff can also submit a question to myself and Command Sergeant Major by clicking on the Ask the CG Command Sergeant Major link on the SharePoint page. And we urge everyone to speak up without fear of retaliation. Know that your voice truly matters to us, and we want to ensure that we are fostering a positive, supportive environment. I'm just not sure that more surveys are always the way to do that, because the response rates tend to be just really low, and we found that other avenues can be just as effective. So we'll look at it.
So that's a valuable question, and like the CG said, we usually don't get the participation that's really required to get an accurate assessment of the entire organization. The 17% usually consist of those that are highly motivated and want to have their voice heard about all the great things that they know about in the organization, or a percentage of those are the folks that really have something negative that they want to express in those surveys. So I highly encourage the entire organization that when we do have a command climate survey, to participate. Your voice matters, and what you have to say about the organization helps us develop trends so that we know where to devote our resources to improve the organization.
Thank you. The op tempo has been high, but soldiers still need leader-led discussions on military leadership, Army values, and other profession of arms topics. Would leadership consider hosting a virtual leadership professional development or NCO development program on Army and other military subjects?
So I'll take that one, sir. That's a great question. And the good news is we have many programs underway and some that have already been going on. But we'll ensure we do a better job at getting the word out. Our next leader development program is on the history of BAMC on 17 March. We'll post details about this event and others on the SharePoint and in the bulletin. We appreciate your interest in professional development. And a reminder, there's many professional development programs within the organization. The LPD, there's officer-centric professional development, there's non-commissioned officer central development, and then there's junior enlisted professional development. And our other team members, our civilian employees, are always welcome to attend some of those. The non-commissioned officer professional development program follows Army doctrine. It's professional development 2 levels down. We have a structured program that goes out annually or the fiscal year in advance. And it's structured and tailored for that specific peer group. Thank you.
Thank you very much. Great answer. We got some Facebook questions, so I'm going to switch over to that. Someone asked, and we can certainly provide information in the comments section after the town hall if we don't have an immediate answer. Can current GS employees who have completed an RN program apply for RN positions?
So that's a question that I'm actually looking into. I saw that someone had asked that, and so I'm checking with the deputy commander of nursing to get the ground truth. So that's something we can answer in the Ask the Command Sergeant Major CG section. So I don't have an answer right now, but we'll get back to them.
We'll definitely make sure we
Yeah.
post a response. Thank you. How many weeks between receiving the COVID vaccine can you get your Tdap if you are pregnant?
That's a great question. So right now, because all these vaccines are new, we're trying to avoid administering 2 different types of vaccine at the same time. So what we want to do is we want to at least ensure that you have at least 2 weeks between completion of your vaccine series and administering another vaccine. So 2 weeks between. So make sure you complete Pfizer, wait 2 weeks, and then you can get your Tdap.
Thank you. Next question. Can leaders encourage other leaders to work with people to improve work-life balance during this stressful time?
Yeah, take a stab at it.
I'll touch a little bit of that one.
Yeah.
I 100% agree. All leaders within the organization, and everyone can be a leader. You should highly encourage individuals to use all the tools available to you: chaplain services, behavioral health, professionals that have experience in dealing with life situations, to be able to balance your workload with what you would consider, your home life or what you like to do outside of work. A tool that I use to balance life for myself is I look at it this way: do as many things as you can, as long as they're legal, moral, and safe, that make you happy about being you. You like going kayaking, do a little more kayak. You like watching movies with your family, do that. You like cooking, do more of that. Whatever puts a smile on your face and makes you feel good about being you, do as much of that as you can, as long as it's legal, moral, safe. And then have discussions with your leader. Be open and honest with them about what's going on in your life so they can help assist you in getting the resources to help you balance your life in regards to the work up tempo or the stress or anxiety that you may be experiencing. Anybody else wants that?
Yeah, that's all good, Sergeant Major. So a couple of things to add on to what he said. Number one, I think that as leaders, we have to acknowledge that people are under stress. I think it's important for us as leaders to find time to leave the office when the workday is over, to take leave, even though it's hard, so that it shows other people that they can take leave. Just today, some of the command staff went over to the Vocal Resiliency Center, and we took a class on cooking and did some yoga and some meditation as a group. And it's those kinds of things, being able to carve out time, as hard as it is, right? Because work is always there, to acknowledge the stress and find constructive ways to deal with it. I also think that as leaders, we have to look at and balance what is urgent versus what is important on a daily basis. And so, for example, as a command staff, one of the things we do is block out time every week for a reflective article. The one that we're currently doing is on how to deal with burnout. And it drives conversation. It gives people an opportunity to talk openly about what's on their minds. We do it, as like I said, as a command group, and I think it's important. There's always time to do what's right, and taking care of yourself is always right, because if we don't take care of ourselves, then we're no good for anyone else. Anything to add to that?
Thank you. Great advice. BAMC is blocking many internet sites, even ones needed for mandatory training or for patient education. Can we gain access to those sites?
Yeah, I'll take that. So the Defense Information System Agency, or DISA, not BAMC, or not the Army, is the approving authority for site access. Now, many sites that are not standardized across the entire enterprise are blocked until they can be assessed for potential threats. In other words, the default is that they're turned off unless someone sees that there's reason to turn it on for security reasons. If a particular website has not been approved by DISA and is blocked at this time, any user on the network can submit a request to have the block removed with the appropriate justification. Please reach out to our IMD help desk at 1-800-600-9332 to request reinstatement of a website that's currently blocked for use. You can create an online ticket as well, and we'll post the website in the comments section. So that's an easy fix. It's just a matter of submitting it with a proper request, not because I want to check my stocks at lunch. It has to be related to the job.
And so I'll add to that. I know we've had a few staff members reach out to me having trouble to access the BAMC all messages or the bulletin as a link that goes out. When they click on it, it's blocking them and won't let them access it. And so I would refer you back to the IMD number that was provided earlier. It could be an issue with your individual account, because I know other staff members that are still able to access those links when they're sent out, such as the bulletin.
Related to that question, why do we have so many different types of search engines and different levels of access on each one? I sometimes have to go from Explorer to Edge to Chrome to gain access.
Great question. The good news is all of our browsers are up to date and cleared for access on the network. Please keep in mind that as BAMC transitions to the military health system domain, there may be fluctuation in network operability. This may require you to use the authentication option for your common access card when attempting to gain access to a particular site. In some cases, you may be unable to access a website until you validate the link as a trusted site. We encourage everyone to contact the IMD help desk with any issues or access concerns. Additionally, sometimes it could be the potential browser that you're using. If you're using Chrome or the regular internet icon, I know some websites it's easier to get to them when you use Chrome versus the other one. At least, I've experienced that myself. Trying to get into EES, it works better when I go through Chrome versus the other browser.
Thank you. And we did post the link to the website if you need help in the comments section. And unless we get any further Facebook questions, and people are still invited to submit those, one of the final questions is, it's spring break for my kids this week, and I think some people have spring break next week as well. And I would like to visit family. I've had both doses of the vaccine. Is it safe for me to go see my family and friends?
Sure, I'll take this. So this is actually a great and very timely question with hot off the press guidance from the CDC yesterday. But before I discuss the CDC guidance, I want to clarify that this guidance has not been approved by the Department of Defense and does not apply to BAMC or JBSA at this time. So back to CDC guidance published yesterday. So according to the CDC, fully vaccinated people, meaning you've received both doses, it has been greater than 2 weeks from the completion of a 2-dose series, so that would be the Pfizer or Moderna, or it's been greater than or equal to 2 weeks after a single dose of the Johnson & Johnson vaccine. So if you're fully vaccinated, you can visit with other fully vaccinated people indoors without wearing a mask or physically distance. So that's visiting with other fully vaccinated people. You can also visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease, indoors without mask or physical distance. So again, you can visit with an unvaccinated single family and you're thinking about, is anyone in that household at high risk for COVID-19 disease? You're protecting them because you're fully vaccinated, okay? You, additionally, you can refrain from quarantine. So this is, again, not what BAMC or JVSA, Department of Defense says, but this is from the CDC guidance. So you can refrain from quarantine and testing following a known exposure of asymptomatic. We're still maintaining the quarantine guidance for healthcare providers. Additionally, we still recommend, or the CDC still recommends, to take precautions in public by wearing a well-fitted mask and physical distancing. Wear masks, practice physical distancing, and adhere to other prevention measures when visiting unvaccinated people for an increase of severe COVID-19 disease, or who have an unvaccinated household member who is at increased risk of severe COVID-19 disease. Wear masks, maintain physical distance, and practice other prevention measures when visiting with unvaccinated people from multiple households. Avoid medium and large size in-person gatherings. Get tested if experiencing COVID-19 symptoms. Follow guidance issued by the individual employer. So this is where the Department of Defense and BAMC guidance is important, specifically for quarantine and masks. Follow CDC and Health Department travel requirements and recommendations, which were not updated, and they still advised against travel. So to answer the question, if you're fully vaccinated and it's been greater than 2 weeks since your last dose of the series, you can safely visit vaccinated family members indoors without wearing a mask. You can also visit with a single unvaccinated household if the household does not have individuals at risk of severe COVID-19. Once you expand to multiple unvaccinated households, now you have a neighbor, other family members from other households, then you should visit outside with masks and social distancing. I know that was convoluted, but I hope it answered the question.
So to make sure I understand and clarify,
Yes, sir.
we're outside of a federal building, right? So all of us here have been vaccinated, so we could meet together off post,
Yes, sir.
right? And but the risk is if I'm going somewhere, the vaccine protects you from getting it. You can still carry it. So the key there is that if you're going to go visit with somebody and they're high risk, you still have a risk of spreading it to them.
Correct, sir.
Okay.
And if they're not vaccinated, so that's where that comes into. That's why it keeps repeating the risk of severe COVID disease, because you could be a potential carrier and infect them. And we keep getting more and more evidence that that's maybe unlikely, but we don't know for sure. So that's where all the additional precautions are, sir.
Thank you.
So I just highly encourage common sense. Continue to wear your mask so you can protect yourself and you can protect others. Continue to wash your hands or hand sanitize as often as you can, and then physical distancing yourself from others, so that we can protect the community until the majority of the community has received the vaccination.
Thank you. We kind of alluded to this earlier, but someone may have tuned in a little later. They're asking do we think we'll get the Johnson & Johnson's Janssen vaccine?
Yes, sir. I can take this. As of right now, there's no indications that BAMC will get it in the immediate future because of the shelf life stability. Johnson & Johnson is primarily going to those more austere locations that can use it better. With that being said, we might see some trickle-down effects of what Johnson or what Pfizer was allocated for those locations. We may or may not see more of those Pfizer or vaccines here. So at this point in time, we do not foresee Johnson & Johnson in the immediate future.
Thank you. Final question, I believe. Is there any possibility to get vaccinations for international military students from other countries?
I'll take this one, sir. Is there a possibility? Yes, there is a possibility. That is not at our level to decide. It is being handled at echelons above. So if there are particular circumstances about that, if we can get that information submitted and we can vet it through the proper authorities, we can potentially get that approved.
Thank you very much. Well, that concludes all of our questions. Thank you to our awesome panel members for taking the time to provide this important information. And thank you so much to everyone on Facebook who took the time to watch and submit questions. As we mentioned earlier, if we did not answer your question, we'll post the response in the comment section later. Sir, Command Sergeant Major, any closing remarks?
All right. So first off, thanks so much to our panel members. We really appreciate the knowledge and science you bring to this discussion and the great answers to the questions by the field. We hope that this town hall addresses most of your current questions regarding the COVID-19 vaccine and other things going on in BAMC proper. So we'll continue to provide updates during our monthly virtual town halls, the BAMC 6 Sends, weekly, our website, and our social media platforms. And also, I want to put in a plug. So, we talk a lot about everything that the team is doing, all the hard work, all the milestones. It's kind of funny because unless you really sit down and I know for myself, unless I go back and look at my calendar, you don't realize how busy we all are. And so the team has done a great job of putting together a BAMC 2020 year in review. This is currently in draft. It will go to print very soon, and it will be in digital format for use by the population. But be on the lookout for this. It is basically a compendium of all of the things that you all as a team have done, the phenomenal work that's been done over the past year by Team BAMC, captured in a binder that will go out to the community and to DoD leadership, just talking about everything that we've done as a team. Sorry, Major?
Please keep in mind that some of the information we've shared today may change in the future as we gain new information and guidance is updated. We encourage you to continue to reach out to your chain of command, these experts, or your command team if you have additional questions or concerns.
And as always, remember the 3 W's. Wear a face covering, watch your distance, and wash your hands or sanitize regularly, both on and off duty. So on behalf of the entire command team, we appreciate every member of this team. We know the past months, the past year, has been very stressful. Thank you for continuing to provide safe, quality care to our patients, and thank you for your continued professionalism and dedication. Please take care of yourselves, your families, and each other. Stay safe. One team, one purpose.